Hello, it's Professor Mark Whiteley from the Whiteley Clinic, and I'm going to talk today about what you should do after you've had your varicose vein treatments. Now, I know many people try to treat varicose veins all in one day, and that's been shown not to have really good long-term results. And so what I'm going to talk about is what you should do after you've had your veins treated by the Whiteley Protocol. And the Whiteley Protocol has 3 stages, although some people only need 2 or even 1 stage, depending on what the problem is. Stage 1 is when we correct the reflux, and although most doctors only think about the saphenous veins that have lost their valves, of course we've found that by all our research that it's not just the saphenous veins, it's also the incompetent perforating veins in the majority of patients, and some patients even the pelvic veins. So if you've had your pelvic veins treated by pelvic embolization, you're really back to normal almost straight away. It might be a little sore, you might feel a little like you've got a bit of flu for a couple of days, but really there's nothing that stops you doing anything straight afterwards. If we're talking about the anti-reflux stage 1 of your leg, so endovenous laser ablation or one of the other techniques that closes the veins with heat, radiofrequency, microwave, any of these other techniques, and with or without phlebectomies, and usually with the trollop technique, when we've finished that, we've completely stopped any backward flow in the legs, or what we call reflux, and so we know at that stage the leg is working properly again from the venous point of view. Patients wear a bandage and a stocking overnight, and the day after the surgery they're already walking normally on the way home the same day, but the next morning they can take the stocking down, take the bandages off, pull the stocking back up, and then 2 days later they take everything off completely. However, right the way straight after surgery, walking is back to normal, and from the next morning onwards, driving back to normal. Now, if we're talking about stage 2, which is the ultrasound guided foam sclerotherapy, that's a much easier procedure to have done, but it does require 3 weeks of compression of a bandage and a stocking. Now, you can do everything, and you should do everything. You should keep walking normally. You should go, I would say, for long walks rather than going to the gym, because if you're not taking any of the compression off, you don't want it to smell, so you don't want it to sweat heavily into it. So you just wear the compression for 3 weeks, and then when it all comes off, you can go back to complete normality after that. And exactly the same for stage 3, which is the microsclerotherapy, but without the bandage, just a stocking day and night for 3 weeks. You can have showers during that 3 weeks just by having a plastic cover over the bandage. But apart from that, if you can do it wearing a stocking, then you can do it normally. And the only restrictions on what you do is really just anything that's going to make you sweat or anything you can't do, such as swimming when you're in a stocking.